Hello dear patients, today we are going to talk about the case presented on the picture, a case of herpes zoster. The patient came to us from a business trip. He got overcooled 10 days ago while staying in a different city. So rashes appeared on the body, in the area of trunk and armpits. These rashes were quite painful. He went to dermatologists and a diagnosis of herpes zoster was set correctly, but for some reason antibiotics were prescribed. No analyses were prescribed, which is strange again. He came after using these antibiotics, complaining on quite strong pains. In 10 days these darker spots developed, which are often a consequence of gradual decrease of inflammatory reaction in the skin, and they develop after herpes and other inflammatory diseases. So he was observed. In such cases it's mandatory to take analysis for syphilis and HIV, as herpes zoster can be a speed marker of these diseases. It's mandatory to take analysis for herpes zoster, PCR analysis, scraping from rashes. PCR analysis is also taken, and immunoglobulins A, M and G are taken for herpes zoster. This was done in this case, and it's also advisable to take immune status and other analyses aimed at supporting the immunity if necessary. However, this patient was in Moscow for 10 days only, so he refused to have such long-term analysis so far. He chose to do some immediate actions. So, what was acquired? First, positive PCR analyses were acquired from blood and scraping from skin for herpes zoster. They were positive. And then positive immunoglobulins G, A and M for herpes zoster. So almost all analyses that we did, apart from syphilis and HIV, were positive. So what is done in such cases? For the first time since the beginning of disease, antiviral therapy was prescribed to this patient in the form of Valtrex 3 times a day. Secondly, drop infusions of ozone and panavir every other day were prescribed. And then painkillers were prescribed. These were anti-inflammatory medications like diclofenac and painkillers due to severe pain. The patient was unable to sleep. In such cases, tricyclic antidepressants are prescribed. Doxepin was prescribed to this patient. Also, to decrease local tenderness, together with antiherpetic ointments like aciclovir cream, etc., creams with lidocaine are prescribed and amla cream. Abroad, capsaicin cream is also used. This was prescribed to this patient to decrease pain during treatment. In 10 days the patient started to sleep normally. Before leaving the city he did control analysis, PCR analysis, scrapings from skin surface, and blood analysis were negative, which indicates a positive dynamics. So he came for further treatment at the place where he lives. So, during any skin diseases, the more so infectious skin diseases, you shouldn't neglect analysis, and it's advisable to find the right doctors who would prescribe a correct treatment. If it is necessary to diagnose and treat different types of herpes, you can consult dermatologists and venerologists of our paid medical center of Dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.